So why are we talking about fibrosis? Evidence shows that breast cancer survivors are at risk for developing one or more types of fibrosis, as well as lymphedema. What is fibrosis? It happens when healthy tissues become damaged. They get hard and thickened. Common causes in breast cancer are surgery and radiation therapy. This creates pain, restrictions in movement, strength, and function. It can damage lymph circulation, which increases risk of swelling. We treat fibrosis because we want to increase lymph circulation, decrease swelling, relieve pain, and improve movement and function. I'm here to tell you that it's possible to treat even long-standing fibrosis. So let's take a look at the types of fibrosis that we see in breast cancer. This picture shows a woman who just completed radiation with a keloid scar. We'll talk first about radiation, how it can damage a large area, and it makes the tissues become thinner, harder, and more brittle. Radiation therapy can aggravate the damage to surgical scars and make them harder and denser. And the damage from radiation can progress for years. We're looking at an armpit with an arm going off to the left, and you can see some little cords there that are not tendons. These are also called axillary web syndrome, where these little cords of tissue run between the armpit and the elbow. They can also occur running down the trunk or to the hand, and they can be quite painful and restrict arm movement and function. Next, we're going to take a look at seroma, also called lymphocele. And a seroma is a pocket of fluid, which is a pretty common complication post-mastectomy surgery. I've also seen them post-lumpectomy. And it increases the risk of infection. There can be pain and decreased arm movement. The treatments are usually to aspirate, which is to put a needle in and draw out the fluid, and then to compress so that the sides of the pocket will stick together and not fill up again. But if they do, it can become a very hard mass. I laid out 5 different types of treatments that I want to discuss with you today, and there are many, many, many different types that can be done in the clinic, but these are all ones that can be done at home. We're going to start with massage. So this is particularly useful for the first 7 types of fibrosis, which are more scar-like, as opposed to the lymphostatic, which is more fatty-like. The exception being the necrosis. So with scar massage, you're going to gently stretch the skin. You might even want to use a small vibrator, but just be sure that whatever you do, that you're not causing pain. You want to increase circulation and tissue flexibility, and it's important to give the tissues some healing time if you've had recent surgery or radiation therapy, and to start gently with massage around the scar and then work towards it. Clean skin has the best traction, so that you're not slipping around, and also so that you can have some impact on some of the deeper layers. So I recommend doing this after a bath or a shower, and then after the scar massage using oil or lotion. If the tissues are painful, very hard, or very thick, it might be necessary to seek some professional treatment. This is an example of a half jacket that's appropriate for breast edema, and you can see that this breast is very, very fibrotic. And after this patient started using the jacket, she started noticing a lot of softening in her breast.